Welcome, welcome everyone, wherever you are in the world, in the universe. My name is Janie Lavelle and this is Sage and Seer Emporium. It's a real pleasure to be here today. I've got a wonderful guest with me today, Rita Kara Robinson, all the way in Wales. Cardiff, are you in Cardiff?
Swansea.
Swansea.
Yeah.
Swansea. So Rita is a homeopath and she used to be a teacher before she found homeopathy, and found homeopathy through her children, and literally how a lot of us find homeopathy really. But she has managed to niche her practice into helping children on the spectrum, and has specialized in the last few years into autism, OCD, ADD, and also asthma and eczema cases, and runs a really busy practice in Swansea, has a team of homeopaths that she works with, and is really kind of starting to help us understand on a much deeper level how we can help autism and children on the spectrum with homeopathy. So I'm really happy to welcome Rita to the show today, and it's always been my endeavor and my intention with these conversations that we help people to understand that there's much more to healing than using pharmaceuticals, and that we can lean into all these different modalities that are available to us. And homeopathic medicine is really showing up in this area of health and healing, as you will see now once Rita gets chatting. So welcome to the show, Rita. It's really amazing to have you here again. We recorded a chat back in December 2021, and when I went to load the chat up, it had just disappeared into the ether. So we're going for take two a while later. So it's really amazing to have you back. Welcome to the show, and sit back and relax, everyone, and enjoy the conversation. So yeah.
Thank you, Janie, for that. Such a warm welcome. Thank you. And I'm sure we'll talk about completely different things this time.
I think that's what happened last time. We decided to do a show on your practice, and we ended up discussing a whole array of other stuff. But I think maybe let's go straight in there. And I know what's really actually quite relevant for you at the minute, and what you've been seeing loads of in your clinic, is tonsillitis, asthma, and eczema cases. So do you want to maybe chat to us a little bit about that, and maybe your ideas and opinions on why that's so relevant at the moment, Rita? Why are so many children experiencing eczema, asthma, tonsillitis? What's your take on it?
Why? The why? I think there's probably, I would think there's actually no increase now. I think it's always been there. But I think over the last 3-4 years, maybe due to the pandemic, I'm not sure, there are, or is it that we're on more social media, that we have a platform to talk openly about these things, that people are maybe becoming a bit more like that, not people, but people that were mainly into mainstream medicine are now starting to think, actually, is there another way? Let's have a go.
Oh yes, right. I see what you mean. Yeah, more people are looking for alternative.
I think so. I think so. And I think that the pandemic has possibly opened many people's eyes to what is really going on with the health service. The fact that our health service is really on its knees in the UK. Anyway, it's hard to get an appointment. When things are everything is digital. When that's down, everything stops. You can't get appointments. It affects the hospitals, and people are starting to have these kind of experiences. There's waiting lists, huge waiting list to see people. They were already waiting list before, so that's now double, tripled. I actually have doctors and the surgeons as my clients.
Wow.
So they are really giving me an insight to what is happening from their point of view. And these are conversations that they would not have with their patients. Because we talk about their whole life and they have to discuss, how work is affecting them. I'm really getting a fantastic insight to what is happening, and the system is broken, and it's not people, and it's not from the doctors and the nurses. It's not for not because of them. It is a system problem which they cannot fix. They are completely powerless to fix this. So if things have got worse over the last few years, you're going to have a percentage of people that are going, right, what are the alternatives?
Yeah.
And I'd say what are the top alternatives for modern medicine? I would say Chinese, acupuncture, homeopathy are the main, like everyone's heard of them.
Yeah, absolutely. And I think even more so now as well, what's starting to become huge in Ireland is herbalism. Again, many people heading back into herbalism and natural law to help heal conditions, exactly like what we're talking about, for mums to be empowered to treat their own children and not have to rely on the pharmacy or the doctor. It's so similar here in Ireland as well, Rita, with the healthcare system. It's not on its knees anymore, it's on its face. It's just kaput. It really is broken. And people are searching for alternatives. That's and that's what I really endeavour to do with our conversations, is to help people connect dots with their healthcare and then to find other modalities that they can use.
Well, the one thing with eczema and asthma in particular, and actually I'd even say tonsillitis as well, is that the doctors don't have anything to cure it, and that's really important for the listeners to understand. What they're being given is things to manage it, not to make it go away completely. So with eczema and asthma, the top tier is steroids. And you and I know that steroids isn't actually fixing anything. It's stopping your immune system from reacting in a way that you don't like. Whereas your immune system is trying to figure things out to fix your body.
Sending you all the symptoms as the messengers. Hey guys, I'm here, check me out. I'm having a flare up, something's not right.
Exactly. So let's take milk as an example. If milk is causing this, and it's not always obvious because people think they don't always have a milk allergy or intolerance, when actually they do. And it can actually stem from formula milk as a baby. Oh, because they had formula milk, well, there isn't a problem. Well, actually, they probably did have a problem with chronic constipation and other issues, which haven't been called up. But let's just take milk and eczema for it, right?
Yeah. Okay.
They don't know that milk is an issue, so they're gonna keep drinking milk and get eczema, and then they'll try the over-the-counter creams. Then they'll try some heavier creams on prescription, and then they'll go to steroids. Steroids isn't going to make your milk intolerance go away.
Yeah.
It's just going to stop the symptoms, and then it will come out elsewhere. You'll just get other symptoms. And that's what's really key in the work that what you and I do, is that we're going to heal what the problem is. So we'll heal the eczema, we'll heal the milk intolerance.
Rebalance the digestive flora and bring that biome back into a state of harmony where the symptoms, don't express on the skin. And I think for those people watching that might not know, that often when you suppress eczema with a steroid or cream, like Rita said, those symptoms are going to pop up somewhere else. And often what we see is they go into the lungs, and then we have the asthma. So eczema and asthma are really, really closely linked. It's not always the case, but in a lot of cases, yes. And I'm sure you find that in your clinic, Rita. Yeah.
Yeah. And then you've got other allergies, then they're more prone to other food allergies, prone to dust allergies and pet hair allergies and hay fever. So you've got a whole spectrum of issues, and it's all stemming from the gut. So eczema is a really good example to show that where the problem is starting isn't where it's showing. So it shows on the skin, but it's actually the liver and the gut that is imbalanced.
Yeah.
And doctors don't have anything to really balance the gut.
Yeah.
And that's the same for asthma. And the way that we fix asthma in our clinic is if they've been on steroid inhalers, we're detoxing the steroids, because steroids in the bigger picture cause allergies.
Yeah.
Not maybe for everyone, but they do cause allergies for many. So you are in a circle that you cannot get out of. You have to try something else, because if you stick with normal meds, you will be on pathos for life, and you will be on creams for life, and possibly even steroid creams all the time for flares.
Yeah.
So I think some people, from what we do and social media and mums chatting and then sending links, oh, why don't you go and look at this person and read about what they're doing, seeing that, oh, you mean there is an alternative to pathos? You mean that my child actually might not have to be on pathos for life, because the doctors have told them everything's for life.
Yeah. Yeah.
Right?
Yeah.
They just don't know it. They don't know it.
Yeah.
And let's go to the mums in the playground, right? I'd say 80% of them will only go to the doctor and only do what the doctor says. And you've got a 20%, which is small, of using alternative therapies, right? And then you need really to find a mother in that playground who is using alternative therapies and has had the same issue as your child.
Yeah.
So if your friends are not telling you, did you know that you can heal asthma and eczema in a different way? How are you going to find that out? But that number is increasing.
Absolutely. Totally. Yeah. Couldn't agree more. And I think you're right. What you said at the start of things, as awful as the pandemic was, it has really driven people to look for other ways to heal themselves. That's why I set the Sage and Seer chats up in the first place, was to help people understand what's out there, what else they can utilize. What percentage of your practice, Rita, are you treating asthma and eczema cases? Has it like?
That's a good question. I'd say my practice is probably half on the autism spectrum. And then I'd say a quarter is mothers, adults, all sorts of things. So when a child comes and the mother comes, or the mother tells their friend to come for a lot of energy, thyroid, anxiety, OCD, just coping with life. Or they've been on a lot of meds and they want to come off them. So I'd say that's a quarter. And then the rest are, I'd say the last quarter are asthma, eczema, and tonsillitis cases. And I really like doing them because the autism cases are very long term.
Yeah.
Right?
Yeah.
I'm
difficult as well. It's difficult. Autism is tough going because it's not just one thing, is it?
That's right.
Well, with a lot of things, it's not just one thing, but you're a huge advocate for nutrition in all of your cases, and I know how important that is to make sure children on the spectrum, because often they're really fussy with what they eat. And that's a huge portion of what you do, is helping families to understand the nutritional component in their child's case, and also the family, isn't it? It's the wider family that also ends up needing treatment because of the stress that you have to carry on an everyday basis, trying to look after high functioning kids on the spectrum. It is tough going, and I have a few clients myself that Rita's given me tips with as well, to help these kids. You had developed, this is amazing actually. Rita and another homeopath, Grainne Flannagan, who's on Rita's team, had developed a particular system to help detox children on the spectrum. And one thing they found, like Rita had said, was that there was a lot of issues with milk intolerance, milk allergies. So do you want to talk into how that came about, what you guys discovered and what then came from that? Because I don't know how many people know about the remedy you guys created. I've certainly used it and had great results.
Okay, yeah. So the formula milk study we did. So when I look at a child on the spectrum, I need the medical history. So I'm looking at what's the mother had in pregnancy, because everything goes through the placenta. It's to do with the size of molecules, and almost all medicines are a size of molecule that will go through the placenta. But things are not tested and to see what happens in a child's development 6 or a year or 2 years after having had a lot of medicines in the placenta, right?
Yeah.
It's really important for everyone to know that. And then I'm looking at what they had at labour, and I'm looking at what's the first year, because a lot of children on the spectrum, or their mothers tell me that things went wrong. A high majority, they say they notice things around the year mark. They also have their MMR there, and that's not news to many people, but I have got so much evidence that how many mothers are telling me after the MMR, not directly, because it's not always that day. That is the key that has started a whole lot of stuff. But it's not always for children. That's not always the case. And some mothers say there was a lot of issues early, and they'll say that they didn't tolerate milk, or they were on special formula, or they had a lot of reflux, or they had a lot of constipation, or their stools have never been right. They didn't have eye contact really early on. So having a look at medicines all the time in cases, I was thinking, what is the first thing these children are having in their guts?
Totally.
It's formula milk, and it's a very emotive issue.
Yeah.
So I can only look at it as a substance and nothing else, like no emotive feelings around it that the mother has or society has. It has to be looked at as a substance that's entering that child's body on a daily basis.
Yeah.
And because I detox certain substances, it was clear, somewhat really obvious, that they had milk issues, right? They're obvious. So, right, we need to detox milk then.
Yeah.
And there's no detox for milk that I could find anywhere. And I'd even looked in international pharmacies, and I'm thinking, how have we missed this?
Yeah.
This component, to me, is absolutely obvious. What did help is having my own child who can't tolerate milk. So I'm also seeing things, making connections on a personal level.
Okay.
Thinking, why have we not got formula milk here? So Helios made it, and we've done a study, and we used different formula milks in it. Even I think one was organic.
Oh wow. Okay. How many did you use? 7?
I think no, only 3 or 4. And my memory is so bad since I gave birth to my baby, so don't ask me any phone numbers or specific facts. I can find them immediately, but I can't remember actually how many it was. But I think it was 4. And the main, whatever was the main.
Yes, yeah, the most popular brands of powdered milk. So it's probably like
Cow and Gate
was
Actimel was there, and I can't remember the others.
Yeah. So just for everyone watching, what Rita's saying is that she took herself and Grainne decided what the 4 most popular brands of formula milk was. They got a sample of those and they sent them to a homeopathic pharmacy in Tunbridge Wells called Helios. And then Helios take those milks and potentize them, which means they turn it into a homeopathic remedy. Goes through a particular process, and then that remedy is ready to be used on clients who are showing signs and symptoms that they might possibly be intolerant or have an allergy to milk. And one of the things that we see in homeopathy quite constantly with bottle-fed children is constipation. And unbeknown to a lot of mums and dads, they put aluminium in some of the milk, don't they? And aluminium, I mean, what, mind blowing for anyone watching. It's madness. We know it's madness. Why do they do it? That's unbeknown to us. We all have our theories on it, but aluminium causes constipation.
Yeah. Actually, it's for the clumping. It's an anti-clumping agent.
Right. God almighty.
Yeah. So you'll get a lot of babies with extreme constipation early on, and then they'll be given
Movicol
and lactulose.
Yeah.
Movicol, and I think the 10 most common drugs like that all have a certain chemical in it, which is made from a byproduct of petrol. That's all you got to know. It is because it doesn't absorb; it just passes through it passes through your gut. That's why they use it. And so you've got another problem then. So you've got milk intolerance, probably leaky bowel now, not absorbing nutrients properly, and then helping the body for it to do its jobs, whatever those vitamins and minerals are supposed to do. And then you've got petrol.
Just pulling everything through, good, bad, and the ugly. So it just literally strips your digestive system of all the biome, good bacteria, bad toxins.
It's a bit of a mess. So then you haven't just got one problem, you've got a few problems now. And if you do that for a year, a whole year, and you haven't really realized that your child doesn't react well to milk. I've had lots of patients, and I've said, the signs that you're giving me is that your child doesn't react well to milk. And they are surprised. And I say, stop dairy. You can even not take my prescription. Stop dairy for a month. And there's many children on the spectrum, especially, that will get gains by doing nothing but taking dairy out.
Okay.
Right? Yeah. And they're now 3, 4, 5, 6. So they've had milk, which is no good for them, especially as their first primary source of food all their life. This is a major thing, and I think people don't talk about it because it's emotive.
Yes, totally. Every mother out there is doing her best, has the greatest intentions for her baby, her toddler, her child. And unfortunately, there's no education around, what formula milk does. And for a lot of women, even if they do know, they can't breastfeed for physical reasons or psychological reasons, or there's a whole plethora. That's another can of worms. But it is a conversation that is emotive, and it does upset people, but we have to go there because it's what we're seeing in our clinic, you especially, because it's what you niche in. So it's so delicate. I was actually thinking about that this morning driving to work, how delicate this conversation could be. That as homeopaths, our number one fundamental learning is to not judge. We're the non-judgmental observers. So regardless of what's going on for you and your children, we're here to support you and to bring them back to full health, and that is our number one, you know. But
and
you're right.
Every mother, whatever they're doing, is making decisions out of love all the time, whatever
totally.
that is. So judgment isn't part of my clinic whatsoever, but I do just use information in order to help and guide the prescriptions. That's all that is.
And we have to go back to the root cause. Like, when did this start, you know? And then from there we can unpack the case as we receive your insights and your answers to our questions. Then it becomes clear, and quite often you'll have like the penny will drop moment. And how many clients I've had in the last 2 years that had the old, you know, jab in the arm, and as you talk them back through the case, and then they realize their side effects or their issues have all manifested since that. It's also a huge emotive thing to discuss childhood schedule of injections as well, which you deal with. Also detoxing, all kinds of MMR, and the other scheduled, you know, vaccines. It was on my mind this morning, Rita, because it's a heavy conversation and there's a lot to it. And, you know, like we just said, everyone's trying their best, following the national kind of advice from their GPs, from their midwives, from their family, who are encouraging them to, you know, do this, do that. But at the end of the day, you know, these things have side effects. And some children suffer more than others, and this is where homeopathy and, like Rita said, Chinese medicine or other alternatives can really support and help heal your children or your, you know, or yourselves. So the milk formula, I have to say, I had a case with a young child, and the presenting things was like global development delay, constipation, and it was really clear to me, unfortunately the mum couldn't breastfeed, so from birth they were put straight onto formula, and that's where things I felt originated from. So we did detox the formula from the child and also the vaccines, and there was this huge change. And that's how we know that that's where the problems start, is when you detox the substance from that child's system and they come back to center, they start to talk again, they have a growth spurt, they're having normal stools. That's when we know that, you know, these remedies are working. Thanks, Rita, for that your and Grainne's hard work. Have you seen, you know, is it something that you utilize a lot for the asthma, eczema cases?
Yeah, very much. Yeah, very much. Milk, I'd say, is the top allergen.
Okay.
Yeah, and you know, apart from the delicate matter of baby feeding, you've got it promoted for years, haven't you, as a key food, a strengthening food. Like there was lots of adverts when I was young, buy milk, school has milk.
Yeah.
When it was taken away, there was big uproar about that, how good milk is for people. And then to be told actually it's the opposite for some people, right? And the milk that we have is not the same milk as people were drinking pre-war, which would probably have been from a cow around the corner. Yeah. You could probably go and collect it.
Yeah.
Right? Or a day old. Yeah.
Yeah, it's not been homogenized and all the goodness blasted out of it and then other things added to it to preserve it.
It's a different entity completely. And I think that adds to the confusion and the surprise and people not having a thought that the milk could cause issues.
Yeah. Well, I think so many of the things that appear normal in our society have come from a huge level of conditioning, like that, the milk. And, you know, it's just like every probably person I grew up with, you would have a glass of milk for breakfast or after school, or, you know, it was just, that was totally part of your life.
Yeah.
You go to the shop, you get bread and milk.
Milk, bread and milk, absolutely. And I have one child that cannot tolerate milk and will get symptoms within a couple of days if he keeps drinking it. And I've got one child that needs it. He does really well.
Yes, your own children, isn't it? Yeah. So that depends on the child's constitution. Yes. So what Rita's talking about is some kids can tolerate milk. If you have a susceptibility to a substance, then it's going to affect you negatively. So we have so many tools in our toolkits as homeopaths to be able to deal with those imbalances. And the formula milk remedy that Rita and Grainne have, you know, formulated is one of those remedies that can help. It's a remedy of our time. You know, she's had the great wisdom to see where there was a kind of a remedy needed to help the current influx or increase in asthma, eczema, tonsillitis, autistic tendencies. Then there we go. We've got something to help these children move through whatever it is that's holding them back. What's your... Go ahead.
I think before the formula milk, I think many homeopaths were using the milk. There is a milk remedy, cow's milk, like declaratum.
Yes, yeah.
But I use both now, see, and I see completely, they're bringing different things. I think just detoxing milk in someone formula fed and has had formula problems isn't enough. For the homeopaths that are listening, you know, do go and buy the formula milk detox.
That's what are the indications that you have, you know, like as in the keynotes for the formula remedy? Is there, you know, there always is like a kind of a top shelf list of symptoms that you'd be looking out for. So what are the kind of top ones?
The top ones are, okay, that's a really good question. Well, eczema on the face.
Okay.
Around, especially on the cheeks and around the mouth, because that's showing, anything around the mouth is showing it's got to be linked to the gut, right? And then the cheeks are linked to liver. This is Chinese stuff. Yeah. So, and they've been doing it much longer than homeopathy's been around. So they know that what parts of the face link to what organs. There's a lot of practitioners across different therapies will use that. Absolutely. So if you got on the cheeks, is allergy, it's got lungs, the same as allergic asthma. It's the same kind of thing, right? Hay fever, people will wheeze, things like that. That's lungs, right? So you're looking at allergies. So eczema around the cheeks and mouth is the first indicator. Constipation as a baby, you're looking at if they've had formula, that they've got a lot of reflux, stinky stools. Not right.
Violent, like smells like something's died, isn't it? That kind of, the gut is like...
Exactly. But nappy rash, that can develop. So you can have formula for months and then the baby just thinks, I've had enough of this. And then we'll just start having a bit of a nappy rash. That can be...
Okay, right. Can I ask a question there then as a homeopath? Really, something that I've seen in a couple of my cases, really full on cradle cap, right? Like this really thick crust. And, you know, there are remedies that we use that will move that, but sometimes you use a well-indicated remedy, doesn't work. Have you used the formula milk remedy for cradle cap?
Yeah, because it's like an eczema, it's a skin, it's a skin, because you can have those cracks, you have that thickness on your skin elsewhere. And what we're doing is we're doing that thing, aren't we? Like cradle cap is kind of normal in inverted commas for babies. They just have it. But having one of my kids had that a little bit, and there's one that has actually the milk allergy had terrible cradle cap, which went
Okay.
on until they were 7, 8, 9. And I didn't know he had a milk allergy until he was 7, 8, 9, around there. I couldn't believe that I'd missed it. He wasn't formula fed, but he would get these, he'd get cracks on his face and on his mouth.
Okay, so that's an amazing point, Rita. So what Rita's saying is one of her sons is okay with milk, the other one isn't. And the one that isn't, he had really terrible eczema until she realized he had the milk allergy. He was breastfed.
Yeah.
Okay, so there's still that. If, like what I said earlier, if they're susceptible to something, regardless of all our well-meaning, feeding them, nourishing them, if they're susceptible to something and they're having it consistently in their daily life, then they're going to get symptoms. So he was breastfed, but he was still reacting to dairy products, or was it just milk?
I think, well, dairy products, I suppose I didn't keep an eye on, but we know what happened, because I kind of knew he wasn't great on milk, but he'd have a little bits. And I knew when when he went to school, and I'd always say, you drink water, don't drink that milk anyway, because we'd have it organic anyway. And I said, don't drink the milk at school, it's rubbish milk. Drink the milk at home only. But he would sneak it in.
Yeah, because all the other kids are having it.
Right?
Yeah.
And I could tell because he'd get flaky skin above his lip.
Okay.
And I said, oh, you had a bit of sneaky milk at school. Yeah. So that kept happening. I was like, well, this ain't right. You've got to be milk intolerant. Anyway, so we went on a bit of a roller coaster with that. Yeah, and I didn't really know a lot about milk intolerance. Really, my son taught me about it.
Yeah.
No, and I think I'm pretty observant parent. That's all I do is observe people all day long, like you.
Yeah.
So it's not always, the other thing, it's not always super obvious. It was very subtle with him.
Yeah. And remember that, you give yourself such an amount of grief over things that you miss as a mum, you do beat yourself up at times, and just don't,
Yeah, true enough.
Seek out some alternatives, change what you're doing, because there's this lady I follow on YouTube, and she's a really amazing healthcare practitioner, Barbara, oh God, what's her name? She's Australian, she's a nurse, but she always says, what's the definition of insanity? Trying the same thing over and over again and expecting different results. So true, isn't it?
It is.
So yeah, if you're out there and you're a mum, like, I'm going to link, of course, Rita's info in the area below, and you can contact her. And she's so obliging and so helpful. If any of what we discussed today resonates with anyone out there, it's just a matter of sending an email or a text message, or picking up the phone or Facebook or Instagram or whatever. You're spoiled basically for how to contact somebody like myself or Rita. But it is a real difficult time when you're a new mum, especially if it's your first child and you've been kind of led to believe that all these things are normal. Asthma, eczema, ongoing coughs, colds, earaches. They are normal because a lot of children are starting to experience them, but they never used to be normal. Did
That's
they?
Fine. No, I didn't know anybody with an asthma pump at primary, not one person. There was a bit of eczema around, I guess, but not asthma, no asthma pumps.
Yeah, well, I was a kid in the 80s, just like you, we're the same age. I think one person in our whole school had an asthma pump.
In the whole school?
A blue one. Yeah. Remember the blue one? Yeah.
And when I was teaching, and the last couple of years I was teaching, so I taught little ones for about 20 years. And then at the last couple of years, we were given a special first aid box to put in pumps from kids and that to label them. And in a class of, I don't know, I must have had 26 to 28. I kid you not, the box wasn't big enough for all the pumps.
Oh, wow. What year? What is this, like the 90s or?
No, this was what I started. So that would have been 2012 to 2014. Not enough room for all the pumps in a class of 28.
Oh, wow. God, it just begs the questions like, why is this happening to our children? Why? You know, and I mean, that's a lot of the work you do is uncovering the why, the root cause. And as homeopaths, that's where we go. Doctors have their tools in their toolkit, and I think they are honestly doing their best that they can. But they have to start to kind of broaden their perspective and their horizon on the treatment that they're giving, because it's not, like we said at the start of the chat, it's not curing anything. It's just kind of putting a band-aid over, treating the symptoms, no alleviation, ongoing medication. Every prescription a doctor writes, he gets an endorsement for of some kind.
Yeah, well, I really learned something about doctors and the liver and the gut. So let's take the liver. So especially eczema is very liver related. Liver is not, needs some TLC, right? But if you go and get a blood test on your liver, it will come out fantastic. It will come out fine.
Okay.
So I often see patients who have even got pain in their liver, mind, and their tests are coming out fine. So I don't think their tests test for everything or test what we need to see. Right? So the tests are limited to whatever the machines can provide.
Yeah, of course. Yeah.
And that's the same for a lot of tests. That's the same for these people give me, tests on the gut and stuff. Oh, they're high or totally fine in certain gut bacteria. But we've got, like, I don't know, some ridiculous tens of thousands, or I don't know, some ridiculous number of guts, right? If we're only testing 20, that still means that something that you are not able to test for might be high.
Yeah.
Right. So these tests are limited. So we have to look at symptoms. What can we go on? So what you and I can observe and what we can hear them telling us, right? The symptoms, they cannot lie. So doctors haven't really got any medicines apart from steroids to actually help livers, give them some TLC. They do not have. They don't. Yeah. And I had a patient who had taken a drug overdose and was monitoring the liver levels.
Yeah.
And they were critical. And I said, right, so what medicines are they going to give now? What are they giving now? What are they going to? They said they haven't got anything to give for the liver. And at that moment, I thought, right, this is really interesting.
Wow.
But what you and I do, and what other therapies do, is that we're giving remedies that are old, like chelidonium.
Chelidonium, exactly what I was just thinking. Nux vomica, chelidonium,
berberis. They are some of the oldest remedies on the planet. They go back thousands of years.
Yeah. Because even sulfur, everyone knows sulfur, huge remedy for detoxing. Milk thistle, Sumerian,
Love all those, and I use all of them. And I think we have to explain to people why are the doctors not using them? Because the pharmacies will only get medicines from drug companies, and drug companies cannot make any money on a drug where the patent has run out. So even when drugs are working, now years ago, before I was a homeopath, I had hay fever, and I was on a drug that was on prescription because I had had it so long that nothing in the chemist would work for me anymore. So they gave me this thing on prescription, and then they said, oh, we can't give you that anymore because they've stopped making it. Why? Well, it's not making them any money. The patent's run out, right? So chelidonium's patent ran out a few thousand years ago. No one's making money. They cannot make loads of money. And speaking of money, let me illustrate this one other way. Going back to the tonsillitis, full circle. The tonsillitis is often strep.
Yeah.
And strep was indicated in the side effects from the nasal flu vaccine this year.
Yeah.
Right? Now,
I got like a 90-day shadow ban for listing the side effects from that nasal. I couldn't do any, I couldn't get messages, I couldn't post, nothing. And all I did was post the side effects.
Well, if that happened, that's got to be true, huh? Okay, so if that's not an indicator for that. So what happened was, amoxicillin is the main antibiotic,
yeah,
for strep. And because it was going rampant, what they did is they hiked up the price. So amoxicillin is £2 a box. And that is what the NHS has agreed to pay every chemist for a box of amoxicillin, right?
Okay. Yeah.
And then came all the strep cases, and the price went up to I think I've got it on my desk somewhere here. It's something like £12.
What?
Up to £13. It went up to. So it's gone up to £10. And somebody has done a journal to find out how's this gone up. And the drug company's blamed the distributor, and the distributor is blaming the drug company.
Wow, isn't that amazing?
Okay, so then you've got a shortage of amoxicillin, a shortage.
Yeah, and everyone totally freaking out because they fully hyped it in the media, social media, in the newspapers. Here they were saying some kids had died from strep throat. You know, it was another like campaign just to instill fear in everyone. You know, crazy.
Right. So this kind of thing is going to happen again with something else. This year, next year, it will happen. And then I found out that amoxicillin is only made in 7 factories on the planet.
Oh, wow.
5 of them are in China.
Right.
So if China decide to go, I don't know, politically, we're not friends with you right now, we're going to have a massive shortage of amoxicillin. Now, strep is what you and I deal with anyway. Before this thing happened, you and I were dealing with strep cases.
Yeah.
So people they are being forced to look at other therapies.
Yeah.
And then you've got chronic tonsillitis, and then you've got people having tonsils out. Because they can't do anything about it apart from antibiotics. You're not really healing the cause.
Yeah. Yeah. And a lot of people, if you're watching this and you're someone that suffers with tonsillitis, or your kids are suffering with it, they are like the first line of defense in your immune system. And actually, when you remove them, it allows the pathology to move deeper into your body. So rather than getting the strep on your tonsils, it goes deeper down inside you. It's harder to treat then, and your symptoms often become worse. So actually taking them out isn't always the best thing. You know, for some people, yes, it does have that, reward for them that they don't get sick again. But you do have to remember the bigger picture. Your tonsils are there to serve a purpose, and they are pretty quick to whip them out over here on children. I think if you get tonsillitis 4 times in a year.
Is that right?
I think that's what it is. Yeah, I better check my information on that. But they're quite quick to take them out in Ireland. Well,
they are here. They are, but even more so in America. I get a lot of clients there that are again, but they haven't got any other option. What are you going to do if you just do keep taking antibiotics, which also is good?
Yeah,
it really isn't. It's there for emergencies, for life-threatening illnesses. It's quite magical for that. But to keep taking antibiotics 7 times, 8, 12. I've got children that are only 3 and I've had it like 12 times.
Oh, no.
Your gut up.
Gosh. Such a knock-on effect from that level of medication that, again, parents haven't been advised on, you know.
And I'm dealing with patients who are working with me, and I'm sure you're the same. And then we're dealing with, say, something else. And then then they say, oh, by the way, I've got strep. I say, well, have you got your kit? Have you got your home kit? £50. For £50, you'll get the entire aisle. I think I imagine the whole section of the supermarket, right?
Yeah.
Is in that little kit, because each remedy is, you know, multi-purpose.
Yeah, Polycrest is what has a multitude of symptoms that it will treat. Yeah.
There are several remedies. You think how many remedies are in there? Merck, Hepa, Belladonna, Apis, like just keep going, isn't it? Like, and there's many different ones, because again, to explain to people, one person will have strep differently to another. Some will have it left, some will have it right-sided, some will have tonsil stones, some will have pus, some won't. They'll just be red, chronically enlarged, all of that.
Bad breath, a cough, not a cough, sore glands in the tummy.
So there all need different remedies for that. But the point is that you don't have to rely on amoxicillin. You can do it yourself, and quickly.
Yeah, very quickly. Yeah. So I think I've discussed this before in other sessions. The kit Rita's talking about is there's a few different ones. I think in the UK and Ireland, the main ones are Helios, which do a 36 remedy kit, and then there's Ainsworth. I think there's 42 in there, one, isn't there?
And they have a really easy link to purchase from. Helios, you have to email or phone them. Especially in the UK, you are not allowed to. They're not allowed to put a button on their website for us to purchase in the UK. Because
we couldn't get those kits during lockdown, and you know, the last few years. That's how I met Zach Carpenter, who I was chatting to last week. I wanted to order kits in for my clients. I ended up making them in the end myself, which is time consuming. But when you can't get something, it was all Brexit, and I don't know, like before Rita and I came on, we were discussing the postal symptoms. So many of my prescriptions, like yours, went missing. You were saying yours went missing this year.
They've stopped sending. You're not allowed to use stamps, so we couldn't send stuff out, and the post's been a bit of a. But luckily, we've got people. Well, luckily, I've got colleagues on my team working in different countries, so we can get around.
Sort it out. But having a kit, a homeopathic kit, and working with a homeopath, if you have, a symptom come over you suddenly, then we can help you prescribe acutely for it and treat it at home yourself. You don't have to call the doctor, go to the pharmacy, rely on, medication. You have your remedies there that will work and that will do wonders. And you can learn. The more you use your kit, the more you learn about the remedies, and it's really empowering. And that's what health is about. You have to take responsibility for your health and your family's health. I think that's.
And if you heal the source of it by using homeopathy, we're teaching your body to heal itself.
Yeah.
Now, if you take antibiotics, and I say this to my patients, when they get into a bit of a difficult situation and they go to the antibiotics quickly and haven't contacted me to use a kit, or let's try and sort this out. I'll say, right, well, you need a kit because this is likely to come back very quickly because your body hasn't dealt with, the child's body hasn't dealt with it properly.
Yeah.
Again, it's a bit like antibiotics is just, it's putting out the fire, but it's not sorting out where the source of the fire is. And so many times the mother go, oh yeah, gosh, it's back again. And they'll panic thinking their kid is really sick. It's really sick. But the body's just trying to heal it so it doesn't come back again.
Yeah. You're in a 6-week cycle with antibiotics. You see it time and again. If you're on that kind of roundabout of medication, then you're suppressing what we call the vital force, which is trying to show you the symptoms and the signs. And you go in with antibiotics and it just suppresses what the body is trying to express. And then things all stop. Oh, it seems like they're fine. and then a few weeks later you're back to where you started, and oftentimes it's worse than it was that first time or second time or third time.
And if you have got a lot of tonsillitis, one of the triggers the onset of chronic tonsillitis or chronic strep is vaccines.
Okay.
Like they'll say that the child had vaccine, then they started getting strep and things like that. So detoxing that can really help. That was the possible cause and the cause for many people. So then it doesn't come back.
So did you see an increase in strep, Rita, when they rolled out the nasal vaccine?
Oh, yeah.
Yeah.
This year, for sure. I have had so many strep cases and also so many interested in chronic tonsillitis because strep is a cause of chronic tonsillitis.
So in your clinic, are you dealing with that in prescription-wise with a detox of the vaccine? And also, do you tend then to prescribe strep as a remedy if it's indicated?
Yeah, so yeah, we do both those things.
Yeah.
And then that's kind of sometimes sorts it out. And if it doesn't, then there's other things like maybe allergies. But then we're going back to other stuff, milk allergies. What other meds have you been on a lot?
Yeah.
Looking at other things. Is there a allergic component in the mother's history or father's history? You know, things like that. Looking what is coming along with the strep.
Yeah.
The symptoms. Some people have a lot of OCD and strep.
Okay, right, yeah. Okay.
Yeah.
Oh, that's interesting. How's that kind of connected?
Actually, scientifically, I'm not sure.
Okay, yeah. But no, well, homeopathically or just, you know, in your clinic and practice, have you
in
seen
my clinic,
cases where there's similarities?
A huge link between strep and OCD. But then there's other components. It's not straightforward like, oh, strep causes OCD. That is not what I'm saying at all. I'm saying in a lot of my OCD cases, when I detox strep, we get massive gains.
Okay.
There's far more to it than that. It's quite complex. Some of the OCD has got other issues. It's a hormonal gut issue. And it's not just a mental thing where you need to go to, I don't know, like the doctor maybe send you off in that direction, just looking at the mental symptoms. It's actually the hormones are in there and the gut.
Yeah, that makes so much sense actually when you say it that way, because of the amount of importance that our hormones and our endocrine system have on us. You know, it needs to be, that correlation needs to be made in the medical system of, you know, how important it is. OCD cases, they can't control what they're doing.
Exactly.
You know, they've no, like if they're repetitively washing their hands, or they have to turn the lights on and off all the time, or lock the doors or check the windows or whatever it is, they can't stop themselves doing that.
They cannot. It's a relief. They need to, otherwise they'll feel worse. And because we've got a medical system where each part of the body has a different clinic in the hospital. This is why this is not really ever going to get sorted out with pills or with regular doctors, because you have to see someone that is looking at your mind and looking at your gut and your hormones all at the same time.
Yeah,
holistically. You're not going to go to a doctor and then find a certain bacteria or maybe GI bleeding or, you know, or a growth or anything. That's what they're looking for, physical signs.
Yeah, or inflammation on the brain, or strep in the throat.
Yeah, they're not going to look at all those things together. You're just going to end up looking at the top symptom, which is probably like mental.
Yeah, gosh, well, you're, you know, a huge proportion of what you said you treat is autism and, you know, OCD kind of stuff. What how successful are you finding it? Are you because homeopaths love to talk about their cases, their successes, right?
Okay.
This is what I've done, but let's have a chat about, have you had cases that have been really tough? You haven't been able to crack them, or there's been a reason why they haven't progressed that you've seen, I guess, in terms of like tips for people, Rita, if they don't want to try homeopathy, what are other things they can do for their kids on the spectrum that will help ease their symptoms, I guess,
All right. So the first question is, how successful am I? There's different ways of answering that. Well, first of all, people will only stay with me if they were seeing gains. So numerically, if people are looking for some kind of evidence, I have a wait list and a team because the clients are with me so long term. I can only see so many people a week. And if they go, right, we'll go for another round and another, yes, there's gains, we'll go for another round, right? Okay. So that's numerically the success you can see.
Yeah.
So from a parent, but how they always want to ask how long will it take?
Yeah.
How many children have you recovered? Right. There are a group of children that we have fully recovered and have come off their diagnosis.
Wow, amazing.
There are, but I won't lie, and I will tell every parent that I'm working with that it is a combination of diet, 100%.
Yeah.
But those children may have started with a poor diet where they're rejecting a lot of foods, but those mothers have been so determined, understood that the gut and the brain are connected fully. You cannot heal the brain without healing the gut. So those mothers have been full on with their passion for trying to heal their guts. Their sleep is very important. So they will make sure that their children are sleeping and not staying up because dad works late to see dad. Things like that happen. They're quite common.
So a good nutritional diet, a good routine for sleep.
Sleep is everything. If sleep is not, your gut is going to take time. And there's a lot of children that are not sleeping for many different reasons because, well, a lot of the children on the spectrum are fearful. They take a long time to sleep. And mums are now fed up of lying with them. So they make them come to bed at 10, half 10 with mums. That's not going to work for a little one. So mothers understanding that sleep is important. Other issues that you've got to look at this. I really like it's more than just homeopathy is holistic. I'm looking at the entire case. The entire case. So we're looking at, well, do they like school? They don't like school. They're stressed all the time. Stress, their cortisol levels are going to be high. Is it better that they homeschool? Is it better that they actually not homeschool and see children? That maybe mum's, a bit stressed and that's not working out homeschooling. So looking at the entire thing. And I don't prescribe, we talk about it. We have honest conversations. What's happening in this area? Well, what do you think? What's the smallest thing you can do to change that? How are the family relationships? Like parents going through terrible divorces, that's going to affect any child on the spectrum or not. Right? So if they're anxious anyway, they're going to pick up stuff. And finally, one of the most important things is the mother. If the mother is super anxious and the children can't help it, they're going to pick this stuff up. Right? And I completely understand why these mothers are anxious and exhausted, stressed, grieving for that childhood that their child has not had. A lot of things, grieving, not coping with a terrible traumatic birth that may have contributed to it. All these things, and the mother needs to heal. And I will say it time and time again. Child will heal when the mother heals. Right? Always, always, always.
100%.
And I have so many children that will have a big leap, or they'll be stuck, or they've gone to another home. Oh, I've worked with someone else and it hasn't worked. What about, if I come to you, I say, well, don't come to me then. You book in. You come to me, not your child. You book in. and let's see. And I said, I bet your child will have a shift.
Yeah.
Therapist whatsoever. And they do. And they do.
Yeah.
Because I've run 2 courses now of a group for mothers twice, where the mothers are focused just on the mothers as a group. And they have made healing jumps.
Be a priority. Yeah.
The children have made a healing jump. So,
oh wow, I didn't know that. So part of your, when people start to work with you, then that there's support beyond what you're just doing. The mothers have a group that they're in.
well, I've done a group twice, so it's only for 6 weeks.
I see. Okay.
Twice.
Yeah.
Where there was strong evidence in there when they're saying, yeah, you know, my child's done this, and some of them have worked with me, and some of them are not seeing. The child is not seeing any therapist at all. Just the mother is doing work.
Okay.
And I see it when, you know, mothers will see my team, and I see the child, and the child has had a massive gain, and then I've clocked, oh yeah, you've just seen one of my team, haven't you? Right? And that will work for anyone. That's not just what I'm doing. That'll work for whatever homeopath that mother's seen. And if they go and heal, those children are picking things up in, like, the mother might not talk about her problems, but those children are so sensitive to light situations. They're easily stressed. They're picking up on that mother's stuff. Absolutely. Their facial expression, their tone of voice, the way that they're moving, everything is going to affect them. So that affects healing in the child on the spectrum. So they're not all the same. They're not all the same. They're all coming with different medical histories. So a child that is deprived of oxygen and hasn't got any speech and has been vaccinated up to the eyeballs and been on loads of meds is going to have a harder time. It's going to have a slower journey than a child that presents maybe at 2 years old and the mothers have gone on to it within 4 months, have seen changes. The child is going to recover much faster. That's just life. That's science, really. The groove is deep. So we cannot look at every single case. Like, how quick is it to heal autism? They're all completely individual, and you cannot compare a child that is verbal on the spectrum with a child that is not verbal on the spectrum. They've got 2 different needs. So I think that explains that no one's going to predict. Some are better than others. And
I think sometimes you get clients and they just come that once and then you never see them again and you never hear from them again, and they've had great results, but they don't come back and let you know, or they've had no results and they think this stuff just doesn't work.
Well, when you say no results, I think that's really important.
Well, what they would see, deem as.
So they're coming to me, right, let's take many clients. They're coming to me, can you get my kid talking again? Right? I get that a lot. Can you get my kid talking again? Yeah. But they're on the spectrum, but they're not looking at anything else. Right? They're just going to judge me. Is that child talking in 8 weeks? Which I can tell you is not really going to happen. It's happened a few times, but in 8 weeks, we're trying to do brain surgery without any tools. It's what we're doing. We're doing the hardest job, which even Big Pharma's got absolutely nothing for. But to be given 8 weeks to do something is really, expectations are not matched here at all. However, if there is somebody out that's listening to this, and I can understand the why they think that way, they're just so heartbroken. They just want to go to anyone that says they can make their child talk. However, when I look at that child, I'm not looking at what the mother is just saying, can you make them talk? I'm looking at right, let's have a look now. You've got a turn in the eye. You're not pooping every day. Sometimes you get diarrhea. You're tiptoeing. You've got eczema. You've gone on a pump. Let's just say all these things.
Yeah, yeah.
Six symptoms, 6. And in 8 weeks, maybe the eczema is gone. They haven't used the pump as much, right? Or they're making a new sound. Because I'm not going to get talking.
Yeah.
Or understanding anyway. Understanding has to come first.
Yeah.
Just like a baby. A baby develops understanding and then starts to talk at 2, 3, right?
Yeah.
So if we're stuck, we're going to have to, if a child cannot understand, go and get your shoes, they're not going to start reciting a nursery rhyme in 8 weeks, right? That understanding come first.
Yeah, well, you want that slow, steady incline.
Exactly.
When you're healing, you want a slow. If you take a remedy and you go like that suddenly, that's not what we want. We want a nice, slow, steady increase in vitality, and just take time.
Right? So I'm looking at all those 6 symptoms. They're just judging me on that. They haven't talked, so they're going to try and knock on someone else's door. But what they're doing is wasting time. They're wasting time because someone else has to start again. Now, after 8 weeks, I've got a heap of information. I've got more information than in the first hour. So some stuff is gone. Great. So I know that body can heal. It's evidence to you that the body can heal. And now we've got to go deeper. Every time we're going deeper and deeper. And in each session, the mother will tell me new information.
Yeah.
You can't just tell me about your kid in 1 hour. They're so multifaceted.
Yeah. Yeah, and if they've got large medical history, then there's a lot to kind of, you've got to peel those layers back. If there's trauma there as well, if there's been drugs in the pregnancy or vaccines in the pregnancy or, you know, grief in the pregnancy, whatever, then malnutrition.
Yes, it's a soup. It's never one thing.
Yeah.
Even if something you think that tipped them over, let's just say the MMR. For many mums, I say it was the MMR. Say that tipped them over. I think there's other stuff that made them weak to being tipped over by the MMR. I think there's also the other stuff.
You've got to look at the susceptibility. What's behind that, isn't it? Yeah.
Exactly. And the mothers that understand, I'm looking at everything. We'll come back. We'll come back. We'll come back. The ones that are only judging me on one thing.
Okay, yeah.
No, okay, I haven't got time. I need to go and find someone else. So let's try them. And they'll just hop around. And they've wasted so much time not working on whatever worked in first time. I'll tell you this, Janie, I have a lot of people that have done that and come back to me 3 or 4 years later.
Oh, wow.
Yes.
Okay, yeah.
And I look back, can you see, like, so they go on my wait list now. I didn't have a wait list when I started. So I would have seen them 3 or 4 years ago, right? Maybe even less. And then I thought, I recognize that name.
Yeah.
Let me see if I got your notes. Oh, yeah, they didn't come back for a follow-up.
Yeah.
And then we'll talk about it. Okay, so what happened? And I'll say, look, your expectations are everything here.
Yeah.
And they went round the house. They went to this person, that. They've done everything and they're back. Why? I did see gains, but I didn't think it was enough.
Wow, yeah.
Oh.
Hey, that's a really great message for anyone watching is, you know, healing sometimes isn't a straight line. You know, you can go forward, go backwards. Sometimes you have to go backwards to go forwards. And that patience really is a virtue when it comes to this level of health. And okay, homeopathy doesn't have all the answers. You have to try other things, exactly what Rita's suggested here, your nutrition, your sleep, you know, the fundamental things. Are you hydrated? You know, what's the stress levels like in the house? How are your relationships with your family? Are you supported in your life? There's so much more to it. So we aren't naive in believing that homeopathy is a cure-all. It certainly has a huge place and helping people heal from all the issues that we're discussing. And because we're homeopaths and we know that and we're champions for it, but you have to really stick to, you know, a plan with helping your child heal. And that's what Rita's a huge advocate for that. It does take time. It's not straightforward. You are going to have, times when you feel like you just can't keep going, you can't carry on. This is when, you really have to dig a bit deeper. And that's where the support comes in, when you need to get treated as well, so that you feel like you're stronger and able to deal with life, with what's happening to your child. I think that's a huge part of Rita's ethos, and what she's trying to help you get to is that you start working on the child, and then when you also work with the mum and eventually probably the dad and the siblings, the whole family heals.
Yeah, they're great cases when everybody's on board. They're beautiful cases, and it's so beautiful to see them all blossoming and they all having an effect on each other in a positive way. It's that is great. And
it's empowering. You know what? I've had a few cases this week where people have come in and they've said, oh, all my colleagues noticed how different I am, and oh, my husband is telling me how much he can see I've changed. And that's hearing those things is like, oh, that's just incredible, because it helps that person to heal even further, that somebody has noticed the change in their well-being, and there's less anxiety, or their cough has stopped, or
that's right,
whatever's going on.
That's right. And the other thing that's really important is that, or two things. One is we got to remember the speed of how the body heals. When somebody cuts their finger, that cut doesn't disappear in 24 hours.
True.
It scabs. You got to wait for the skin to come up. It can take 3 to 4, 5, 6 weeks for nothing to completely disappear. We cannot speed up the rate of how cells, regenerate and things like that. That's science. We cannot do that overnight. So that's one thing. And the last thing I say is the relationship between the mother, the patient, if they're verbal, and the homeopath is everything.
Yeah.
Right? So I can understand some people come and say, oh, I've been recommended by you, And maybe, this is just human nature. Not everyone clicks with everybody, do they?
Yeah, totally. Yeah.
It's just how it is. Why are we attracted to somebody? Like, why are we attracted to someone's face or a song? This comes back to homeopathy, really. It's that it's a vibe. Like, I love that song. Why? There's no scientific reason why you will like a certain song, right? You just do. It just resonates, and it can lift you. It could make you cry. It could make you elated.
Yeah.
No scientific why. It's a vibe. It matches you in some way. And that is the same. I think if you're going to go on a long journey with someone, if it's for a couple of sessions, 3, 5, a year, you've got to have a relationship with that person. You've got to vibe.
Yeah.
And I think that's what you and I do on social media. We're pulsing out like a lighthouse. This is my vibe. Do you like the tone? Do you like this? Do you like this visual? This is kind of a little bit of me.
Yeah.
And if you already feel drawn to that, we're likely to work well. You get so close to people, don't you, Janie? In these things, like you can be on a video call, and distance is irrelevant. It is like that person is in the room with you at that moment, right? You are connected fully, mentally and spiritually in some way. You're connecting.
Yeah.
So if a little bit of that isn't there from the get-go, then I don't think things maybe are not going to work so well.
Yeah, well, what you're talking about is resonance and, vibration and frequency. Yeah, definitely. You have to match those two tones of your vibe and your client's vibe. a huge part of the homeopathic consultation is that you don't even get a remedy and there's a healing taking place, actually just being seen, being heard, being witnessed, and having that vibe with your homeopath or any therapist is going to have a cathartic resonance in your body, in your emotions, in your mind, in your spirit.
Totally.
Totally. And I think that's important for people to remember. If you do go to a homeopath and you don't feel like you have that connection, it's okay to go to somebody else.
So yes, because we want you to heal.
Yeah.
It's not like I'm not offended because I've got grey hair now. I mean, I'm old enough to not.
Me too.
Right? It's just the way it is. You just don't mind. I've got two sons that go to the same school, and funny enough, yesterday we were both talking about the same teacher. One really likes him and says he really helps him in that subject, and the other one says he's rubbish, doesn't like him.
Oh, so yeah, there you go.
Very good teacher, right?
Mm-hmm.
Same guy, probably pumping out the same stuff for both of them, right?
Yeah.
But one vibes with him and the other doesn't. It's just human nature.
It is human nature. Yeah. So find someone that you vibe with. I think that's a really interesting thing as well, because it comes back to also what we are taught right in literally the first day that you become a homeopath is be a non-judgmental observer. But we live in a society where it's so judgmental, and people do judge you on so much stuff even before they get the chance or opportunity to work with you. So if you're inclined to feel that way, just, try and put your feelings aside. Find a homeopath that you resonate with, or a therapist of whatever modality it is that you need, and just go for it. Try something different and explore some of the stuff that Rita and I have discussed today. And wish you all the best with it. I actually have to dash off now. I've got an appointment, and I think just thank you so much, Rita. I've learned so much off you today myself. It's been really enlightening. And if anyone out there watching has any questions for myself or Rita, do get in touch. All our details are below. It's been an absolute pleasure to chat with you, Rita, today. And anybody watching, thank you so much. We appreciate you being here, and have an amazing weekend.
Thank you. It's been really nice, and thank you to everyone who has listened, and ditto everything that Jamie said there. Bye.
Bye everyone. Bye. Take care.